Hi, this is Wally Taylor. I'm the Chief Medical Officer of Texas Integrative Medicine in Austin, Texas, and I'd like to share some ideas with you about toxic mold illness or mycotoxin illness. This is a big problem in my practice here, and there's a lot of questions and controversy that comes up as we see people with some of these concerns. Let me start off by saying that what I'm saying today is meant for educational or health and wellness purposes and is not intended to be medical advice, or it's not intended to treat any specific illness. If you think that you are personally affected by any of these problems, I strongly encourage you to seek the expertise of your own personal healthcare professional. So in my practice in Austin, we see people that have a wide range of symptoms that we know are related to exposure to a wide variety of environmental toxins. And we're going to talk in a minute about some of those symptoms. But although there's a wide range of environmental toxins that can cause these kinds of problems in patients, the very worst on the list that I see is the mycotoxin or mold toxins that our patients get exposed to. So since it's such a very strong set of toxins with lethal effects in some cases, and since the exposures to these indoor molds is also so common, it is just a very big problem. And I would also say that although we see lots of people that are afflicted with problems related to exposure to these mold toxins, they almost always have other environmental toxins that they're exposed to, whether it be other germs, viruses, chemicals, toxic heavy metals, or even toxic physical effects, such as electromagnetic frequency exposure from Wi-Fi's, computers, and dirty electricity. So you might start off by saying, well, how would I know if I have the symptoms of mold toxins or exposure to mycotoxins? Well, let me say that the symptoms that we see in this group of folks is the same symptoms that we see in many other folks exposed to many other environmental toxins. So unfortunately, you can't just look at the toxins and really be able to know, you can't just look at the symptoms and be able to know which toxins a person is exposed to and having symptoms from. But in the case of mold toxins, the probably most common symptom that we see is that of chronic fatigue, and this chronic fatigue can in some cases be serious, so bad that people just can't even function. They can't get off the couch. They can't get up in the morning. They can't do anything with their family or friends. They can't care for their children. Now, we do see that sometimes the fatigue tends to come and go. Some days are much worse than others, and some days are actually pretty good. After fatigue, which is most common, we see a lot of symptoms that together we call brain fog. And that's what the patients like to describe it as. But brain fog means problems with cognition, such as memory problems, especially short-term memory, word finding problems, a lot of times problems finding one's way home, uh, being able to calculate, such as balancing a checkbook or even to solve simple problems, sometimes even trouble reading or even following television programs. At the same time, we see a lot of psychological or psychiatric symptoms from these mold toxins, including anxiety, depression, uh, bipolarity, and a lot of insomnia in this group. We also see a lot of digestive problems. People complain of a lot of gastroesophageal reflux, a lot of bloating, constipation, diarrhea, nausea, vomiting, loss of appetite. So a whole host of GI symptoms. We see a lot of endocrine problems, symptoms consistent with adrenal dysfunction or problems with the thyroid. In ladies, we see lots of problems with the periods, anovulatory cycles associated with these toxins. The patients also seem to have lots of problems with the immune system, They seem to catch things and can't shake them. And a lot of problems with aches and pains, whether it be headache or bone and joint pains, arthritis, arthralgias, even muscle aches and pains. So these are the symptoms that we see. And again, the symptoms of the mycotoxin illness overlap greatly with symptoms of other chronic environmentally acquired illnesses like Lyme's disease and chronic heavy metal toxicity and chemical toxicity, and so forth. So you might say, okay, I've got some of these symptoms. What do I need to be looking for? Well, since mold toxins are so serious, we start by trying to take a good history, a history of exposure, because we're always the most concerned about the mold toxins that a patient is currently exposed to. But it's important to know that in some cases, the mold toxin exposure could have been years before, because we know that these mold toxins, which are not proteins, they're typically small, what we call polycyclic amine molecules. They can be quite stable in the body, especially if they're sequestered into the fat cells of the body. So you can actually be sick from mold, even though your exposure might have been years before. The ongoing mold, we always talk to our patients about obvious sources of mold exposure. And since the molds can sometimes be odorless, at times the patient may not have, or the person may not have any sense of ongoing exposure. Some people are very sensitive to these odors and they can smell a musty smell miles away, whereas others not particularly sensitive, so that they may not be aware of it. But certainly you look for areas of staining of ceilings and tiles and sheetrock, walls, wallpaper. You look for the actual mold growth itself. And some people talk about black mold, which at times it is black mold, but sometimes we see that the toxic molds are also other colors such as white or green or brown or even red or orange. So we always like to find out if a patient seems to have evidence of ongoing exposure because of the presence of mold toxins. Sometimes the patients will give a strong history of symptoms starting immediately on exposure to a new location that was particularly moldy. And in addition to the home, some people will describe a school room or a workplace setting that might also harbor some of these molds and mycotoxins. So the physical findings of mold toxins are quite diverse, but I will talk about those in another upcoming talk. So if we suspect that people have symptoms related to mold toxins, you might ask, well, how can we go about trying to nail down that diagnosis? And this is an area of some controversy. Different people have different opinions on it, but you can go about it a couple of ways. You can do an assessment of the environment of the patient. And for the most part, the best thing to do here is to bring in the services of a licensed mold inspector who makes this their living. They can come in and do a real thorough assessment of the indoor environment, looking for evidence of water intrusion, such as a leak from a ceiling or a pipe that's leaked, or perhaps from an appliance such as a washing machine or dishwasher. And almost always these indoor molds, at least initially, have to be associated with some water exposure. So they'll look for obvious evidence of dampness. Sometimes just increased moisture can cause these molds to grow. They will assess the home as far as to see if there's a crawl space under the home, because frequently if a house is on a pier and beam, we see a lot of high counts of mold coming up from the soil, and sometimes this can communicate with the air in the home. Similarly, we find that in the attic space have higher counts of mold, and there might be some cross-contamination of the indoor mold, indoor air that the persons are breathing. One thing that's kind of interesting is that the sensitivity to mold is variable. And there's some controversy surrounding this, but it appears that there might be some genetic predispositions to certain people being way more susceptible to illness on exposure to mold toxins than others. You can check certain genes. For example, the HLA, DQ, and DB genes will sometimes predict this, although there's controversy surrounding this. And there's probably other genes that you can consider that might also have to do with how well a person is able to remove these toxins once they're in the body. So thorough assessment of the locality for ongoing exposure can be valuable, but probably the gold standard, if you're concerned about mold, is to actually assess the patient for the presence of mold toxins. And there's a couple of urine tests that can be done, Great Plains labs and real-time labs, where you can take a urine sample from the individual and send it off for analysis of micro amounts of these mold toxins in parts per billion. But there's any number of these mold toxins, and then these two companies measure slightly different mycotoxins. So in some cases, it's valuable to obtain both of these tests. There are other ways to assess whether or not a person's being affected by these mold toxins. There's any number of inflammatory markers that can be measured in the body, such as the TGF beta 1 and the MMP9 and the TNF alpha, C4A, and there's some peptides that can be measured, such as VEGF and VIP, that can sometimes give us some indication of the status of these mold toxins. It's important to note that there's not large numbers of studies looking at these markers, and we know that there is overlap in many of these markers with other environmental illnesses and other environmental toxic exposures. So you can't just look at any one of these markers and say clearly what is the source of exposure. The problem then becomes one of trying to help a person eliminate these toxins. And the most important thing, of course, is to eliminate ongoing exposure. There you can sometimes have a patient travel away from the suspected source of exposure for a period of days to see if there's any significant improvement in the way the people feel when they're out of that environment. It's very important, of course, to try to go to an environment that has less potential for exposure to toxins. I want to also say that the mold toxins and molds can also sometimes be in some of the personal effects in the environment. For example, a couch or garments or papers and books. So this sometimes comes up if there's been a lot of water intrusion, say in a flood, and a lot of the home effects become moist or wet, and mold grows. And even if a person moves to a different location but takes all of their personal effects, what I call porous personal possessions, they may actually be migrating their mold toxins with them. And so sometimes it's important to try to make an assessment for that. One way that I sometimes do that is to use mold auger plates in what we call a tap test, which is where you can actually take an auger plate and tap it against the surface of, say, an upholstered couch or a mattress or garments, and then have it analyzed for the growth of mold to see if it's associated with mold colonies that are known to be making any of these mold toxins. And we do have some pretty good information that's online about the kinds of molds and the mold toxins that they produce. So if we have found that a person appears to be sick from mold, and we assess that there is ongoing sources of exposure, we make every effort to reduce the exposure. couple of things that we've learned that can be helpful. One of them is to purify the air regularly with really good air purifiers, such as what we call HEPA, or high efficiency particulate arresters. There's several good brands on the market. I particularly like the Austin Air brand and the Air Oasis brand. Additionally, since most of these toxins are entering the body by breathing, first they're breathed, and typically they will stick to the mucous membranes, and then later the mucus is swallowed and the mycotoxins go into the intestine, where they can lead to more intestinal or digestive symptoms. Some of them can be directly absorbed into the top of the nose and even go directly to the brain. But we find that nasal saline flushes performed on a regular basis can often be very beneficial to help wash out the mold and the mold toxins before they really have a chance to be absorbed into the body. Many times the mold toxins are arrayed on the outsides of the mold spores, and the mold spores, being quite light, will readily float in the air and are readily breathed in. Sometimes they can even be breathed into the lungs, where they can cause lung symptoms such as asthma and cough and shortness of breath. So once we have become pretty sure that we don't have ongoing exposure, then it becomes a matter of focusing more and more on how do we help a person eliminate those mold toxins from their body. And when it comes to mold toxin elimination, there's actually a lot of overlap between how we approach that problem, similar to the way we help people try to get rid of toxins from other sources, whether it be other biological toxins, heavy metal toxins, chemical toxins like pesticides, food additives, and even cosmetic products or drugs. But we have to depend on the normal mechanisms of detoxification that we have, such as our sweat glands when we sweat. The liver is responsible for removing lots of toxins into the bile system, where they're emptied into the intestine, and then of course with stooling they're evacuated from the body. The kidneys also play a very big role in filtering the blood and eliminating many of these toxins through urination. But as it turns out, these mechanisms are very sophisticated, but unfortunately, due to the much larger exposure to the host of environmental toxins that our bodies are now required to clear through the air, food, and water, many times these systems can't keep up with the demands of the toxins, and we see a lot more symptoms coming as a result. And there are many things that we can do clinically to try to improve these mechanisms of detoxification, including the diet, our lifestyles, not smoking, drinking lots of clean water, hygiene, and other ways that we can approach this from a natural perspective. So this is just some background information on this whole concept of chronic illness due to exposure to indoor mold and mold toxins. I wanted to also just briefly mention that in addition to the direct toxic effects of these mold toxins, such as aflatoxin, ochratoxin, trichothecene toxins, we can also have problems upon exposure to mold that is allergic in nature. That's when the immune system responds to the presence of these molds in the body with release of inflammatory mediators such as histamine. The symptoms of this are a little different than the symptoms of mycotoxin exposure. Typically, you see symptoms more characteristic of pollen allergy or cat or dog allergy, with itching and watering of the eyes, congestion, sneezing of the nose, shortness of breath, wheezing, sometimes itching of the skin, even hives or eczema type of skin rash. So, but there is overlap between the allergic reactions to molds and the effects of the direct chemical toxins known as mycotoxins. The other thing is that there is always the possibility that these molds can establish colonization in the body. People can actually get infected with mold. In fact, this can be a problem in cases of severe immune suppression, such as HIV/AIDS, or even advanced lymphomas or leukemias, or people that have to take immunosuppressive drugs for various reasons. They can actually get mold infections, which can rarely even become systemic and can lead to sepsis and death. So although this is not that often seen, it's also another way that these molds can cause disease and illness. The mold toxins can sometimes colonize us and not necessarily cause life-threatening disease, but they can actually, in some cases, generate mycotoxins while they are colonizing us. This can sometimes be seen in the nose and sinuses, or in the pulmonary tree, or even in the digestive tract. So if you're interested to find out more about mold toxins, one of the societies I belong to, the International Society of Environmentally Acquired Illness, is a very good source, and there's practitioners around the country that are members of this organization. So you can contact them at their website, and they can help you find a practitioner in your local area. Also, currently, there's a really good mold summit that's being presented by my friend and colleague, Dr. Margaret Christensen, on Mold Toxin Summit, which is available through Health Talks Online. Or if you would like to learn more about mold illness, you're welcome to check out my website, my Facebook page, and I do have individual consultations available, so that we can talk about your individual concerns regarding these environmental illness issues. You can find my number at texasintegrative.com. And I hope that this has been helpful. If you have found it helpful, please consider subscribing to my YouTube channel and share this video to friends and family. And please feel free to comment in the comment section. I'd like to answer any questions, concerns that you might have. And I just am wishing all of you complete health and wellness from head to toe. Have a blessed day.